Welcome back. In health news, Dr. David Wones, Spectrum Health Division Chief of Cardiology, joins us this morning to discuss a rise in deaths during the COVID-19 pandemic. But it's not what you think. Many people with heart disease and at high risk for heart attacks are avoiding treatment during the pandemic. There are even many reported cases of people suffering heart attacks who have avoided treatment. Dr. Wones, good morning. Thanks for joining us.
Good morning, Todd. Thanks for having me, and I appreciate being here this morning for this important message.
Absolutely. It's difficult to hear that people are suffering and not getting the treatment they need. You've even heard the phrase throughout the COVID-19 pandemic, where have all the heart attacks gone? You know, we've heard that because of the cases. What's meant by that exactly?
So sure, Todd, great question. And we're seeing this in our medical literature as well as, in the media. Where have the heart attacks gone? What does that mean? Well, a couple things. This is COVID, and we hear about COVID and heart disease a lot. And so let me make a couple of points there. One is that patients with heart disease are more susceptible to more serious cases of COVID and more at risk. We know they're one of the at-risk populations. But so that's one of the relationships. But the other is that with where have all the heart attacks gone? Sadly, they've not gone anywhere. They've stayed at home. Because of fear of COVID, fear of being out, fear of possibly being in an emergency department, people have avoided going to the hospitals and have had their heart attacks at home.
Doctor, is this anecdotal evidence that you're seeing, or has any study been done to show that there has been an increase in cardiac deaths?
Yes, there is actually a lot of data on this. We've actually contributed some of that data from our own experience here at Spectrum. So there is an increase in cardiac deaths. A couple of things. You're at greater risk of dying of a heart attack, first of all, than you are of dying of COVID. So you should fear a heart attack more than COVID, and that's why you should seek care. It was shown, there are many studies, but, one, for example, 87,000 excess deaths during COVID in a 2-month period in a population, but only 2/3 of those were COVID. So many of those can be patients with heart attacks, who are passing away, unfortunately, at home because they didn't get care. So, there are many studies like the one I've just cited showing that. In many states in the United States, half the deaths during COVID were not due to COVID. And for example, in New York City alone, there was roughly a 400% rise in heart disease deaths during COVID because patients weren't getting care. In Michigan, we saw a similar kind of thing. So, additionally, we've seen. I'm sorry, Todd, go ahead.
Well, no, I think the numbers speak for themselves. Obviously, this is not just anecdotal. So let's get to the action. I think I know the answer, but what should heart patients do?
Well, the American Heart Association, which this is Heart Month, has had a phrase, don't die of doubt, but basically stop medical distancing. So we talk about social distancing, but we should not have medical distancing. You should not be afraid of contacting your doctor. So regular checkups, maintaining contact with your cardiologist or with your physician, keeping those scheduled visits is important, and then speaking up is important. Don't wait to get care. A heart attack is a time-sensitive event, and a delay in treatment puts you at greater risk of a complication or of not surviving the heart attack. So if you think you're having a heart attack, seeking immediate care, calling 911, getting to the emergency room is critically important. Don't medically distance, seek care when you need it.
And I think you were touching on this a bit earlier, but is there a connection between heart disease and COVID-19? What do we know about that?
There is a connection. A couple of comments. One is COVID-19 is not just a lung disease or a respiratory illness, but it's really a vascular illness. The blood vessels are affected. So we're seeing more heart events related to COVID. And we also know that patients with heart disease, and especially those with coronary heart disease or cardiomyopathy, the more vulnerable population with heart disease, are more susceptible to a serious infection with COVID with more adverse outcomes. So heart patients are more susceptible, And again, some of the symptoms can be very similar, and so that's why patients are often, not getting seen, not evaluating, and missing the opportunity to have their heart event or heart attack cared for.
Absolutely. Great advice, doctor. Thank you so much for the time. And what Spectrum Health is doing to promote this message, make sure that you are getting the care that you need. Don't put it off. As you heard Dr. Wones say, it's time sensitive. So more information is waiting for you at spectrumhealth.org/patient-care/cardiovascular. Of course, we'll get a link on fox17online.com. And you can make an appointment anytime by calling 855-7-MY-HEART.